Hello, everyone. Welcome to this week's episode of Navigator Nuggets. I'm your host, Dr. Nicole Rochester, and this week we are going to be talking about a topic that's kind of heavy, and that is racism in our healthcare system. This week is National Health Education Week. And National Health Education Week is the third week in October, so this week it's October 19th through the 23rd. And the purpose of National Health Education Week is to promote the awareness of public health issues and also the importance of health education. So every day this week there is a theme, and the theme for Monday, October 19th, is Health Equity and Racism Elimination, Advocating for Change. Now, if you know me at all, or if you have been following me for a while, you know that health equity is a huge topic for me. It's really important. In fact, I just did a talk last week about racism in healthcare and health equity and inequities and bias. So this topic is near and dear to my heart, and I'm so excited that it's part of National Health Education Week. All right, so let's go ahead and get started. If you have not seen the episode of Navigator Nuggets from earlier in the spring, where I dedicated an entire issue to talking about COVID-19 and health disparities, I encourage you to go back and watch that. We are not going to go into that much depth today, but COVID-19 has been really the case study that illustrates all of the horrific aspects of how systemic racism operates in our healthcare system. So I will put the link to that in the description to this video. So let me just give you a brief introduction to this topic. I will tell you that I attended medical school in the mid-1990s. Yes, I know I look young, but yes. And in all seriousness though, during my medical training, I was routinely taught by professors about the differences in health outcomes and the differences in certain diseases that we see among Black people and other individuals of color. And I will tell you that not once was there ever any indication that these disparities, meaning differences in the actual incidence, meaning how often they get disease, how prevalent the disease is, the complications that they experience, and yes, even death. Never did any of the professors ever suggest that the cause of those differences between the health outcomes that Black people experienced and white people experienced was due to something outside of ourselves. There was always this implication that somehow Black people were inferior. And no, they never said that out of their mouths, but they would present, chart after chart after chart, graph after graph after graph, where you would see that Black people had more hypertension. Black people were more highly affected by diabetes and heart disease and stroke. And it just went on and on and on. And the implication was that either there was some type of biological inferiority, like we had some kind of genetic defect as Black people or people of color, or sometimes it would be blamed on behaviors. So they would say things like, well, African Americans are, more likely to consume unhealthy diets, or African Americans are less likely to engage in regular exercise. So the reality is that back then in the 90s, we didn't really have the terms to describe what was really happening. And I would say, and I'm going on the record with this, that my professors and really the healthcare industry as a whole, particularly with medical education, they were very short-sighted. And despite the fact that there have been evidence for years, you all, pointing to some of the underlying causes of these disparities, that information was not shared with us in medical school. And so we were kind of led to believe, even as medical students of color, that Black people and Latinos were somehow to blame for their own health challenges. Now, don't get me wrong. It is true that there are some negative health practices among African Americans and individuals of color. However, what we now know, and what I talked about extensively in my talk last week, is that there is systemic racism that has been built into our healthcare system from the very, very beginning. And the remnants of that are still very much alive and well. And that accounts for a large degree of the disparities, the differences that we see in the health of Black and brown individuals compared to white individuals. Okay, so just very briefly, I will share with you that prior to the Civil War, there were very prominent white physicians, mostly in the South. They purchased slaves or they were lent slaves to be used for medical experimentation. Yes, you heard me correctly. These doctors used Black slaves so that they could perfect their surgical techniques. And guess what? They did this without any anesthesia. Can you imagine undergoing major surgery, not once, not twice, but in some cases more than 10, more than 15, more than 20 times without anesthesia? Can you all imagine that? And then as we fast forward, we know that there were papers that were published in medical journals that basically made up diseases about slaves, made up mental diseases, made up physical diseases. People said that the skin of Black people was thicker, that Black people didn't feel pain as much as white people. And many of these erroneous theories not only made their way into medical journals, were talked about at esteemed medical conferences, but these theories were used to both support and justify the institution of slavery. So that is the very beginning. And now if we fast forward to 2020, we have seen with COVID-19 just how these disparities play out. We have seen that Black people were not tested to the same degree that white people were tested in. We saw that the very places where they put the early testing sites were in the predominantly white neighborhoods. We saw that you had to have initially an order by your primary care physician to even get tested for COVID-19. And we know that African Americans and people of color are less likely to have a primary care physician. We know that African Americans are more likely to be represented in those frontline essential workers, the grocery store people, the people that, do the stock, the people that drive public transportation. And it goes on and on and on. We know that people of color are more likely to have jobs where they can't just work from home, right? Like I have had the luxury of doing. People of color tend to live in housing where they don't have the luxury of being able to quarantine or have the separate bathroom if one of them were to become infected. So we can see how systemic racism, not just in our healthcare system, but in our society as a whole, has played a huge impact in why the health of Black people and brown people is often and almost always dramatically different from that of white people. We even see differences in things like maternal mortality. The United States has the highest maternal mortality rate of all of the developed countries, meaning we are losing previously healthy women from childbirth. In 2020, you all, we are the only country where the maternal mortality rate is rising, not lowering, despite all of the technology, despite all of the specialists. We have the highest maternal mortality rate. That maternal mortality rate is 3 to 4 times higher among Black women compared to white women. Even if you look at Black women with college degrees, Black women who are in the middle class, upper middle class, even when you correct for those things, we still have worse outcomes. We see the same thing with infant mortality. So the point of this Navigator Nuggets today is really to make sure that you all are aware, particularly those of you in my audience who are African American or Latino. We also see these disparities with American Indians, Alaska Natives. You need to know that there are forces at play outside of your control that absolutely will impact whether or not you receive appropriate care for your medical illness. Now, why is that important? Because that is part of the reason why I do what I do. As a health advocate, I step in and I advocate strongly and fiercely for my clients. But when I do things like this, like Navigator Nuggets, when I speak on stages, the purpose of this is so that you can learn how to become your best advocate. It is the number one reason why I am making these videos and writing blogs and contributing to articles. I need you to learn how to advocate for yourself. I need you to understand that you need to be intimately familiar with your health conditions. You need to read about them. You need to ask questions over and over and over again. You need to sometimes be that squeaky wheel. You need to sometimes be demanding after you have gathered that information. And if you discover that you are not receiving the care that you believe you should, you need to ask why. It is the only way that we are going to begin to level the playing field. And I am happy to say that after George Floyd's murder, there is now a renewed interest in equity and health disparities and racism in our country. And so a lot of energy and attention and some money is being invested in this topic. And so I am hopeful that not this year, not next year, but prayerfully in my lifetime, I am hopeful that we will begin to close these gaps between the health outcomes that are experienced by Black and brown people and those that are experienced by white people. It is not okay, it is not acceptable, and it needs to end now. All right, you all, let me take a deep breath. As you can tell, I am extremely passionate about this topic, and I hope that you are too. Our health is our wealth, and we need to take our health very seriously. And unfortunately, despite what you may be told, only a small percentage of your health outcomes are related to the actual medical care that you receive. A large part of it is due to systemic racism. It's due to these, what we call social determinants of health: where you live, where you work, where you play, your access to education, your access to clean water and green spaces and playgrounds and sidewalks. We know now that those things play a much more significant role than we ever thought. And we know that those types of things are highly influenced in the United States by the color of your skin. So just be aware of the health disparities, the differences in our country. Be aware that to a very large degree, they are both caused by and perpetuated by systemic racism. Stand up for yourselves in these medical appointments. Stand up for yourselves when you go to the emergency room, when you are hospitalized. Stand up for your family members. And if it is overwhelming for you and you feel like you need an extra hand, please always know that Your GPS Doc is there for you. You can go to my website, yourgpsdoc.com, to learn more about how I help patients and families navigate the healthcare system. All right, you all. So again, National Health Education Week is all week long. I may pop in and share some more information with you, so be sure to go to my Facebook page for additional information. And I look forward to seeing you next Monday for the next episode of Navigator Nuggets. Take care, wear your mask, be safe.